Beck Depression Inventory, Beck Hopeless Scale, Beck Scale for Suicide Ideation, and Beck Anxiety Inventory. The Beck assessments are an important tool used to understand various mental health conditions, which include depression, anxiety, hopelessness, and suicidal ideation. Among these assessments, the Beck Depression Inventory, Beck Hopeless Scale, Beck Scale for Suicide Ideation, and Beck Anxiety Inventory provide comprehensive insight into clients' emotional state. These tools have been extremely helpful and insightful in the clinical setting to understand clients' emotional state. Consider the results. Before presenting the results, it is critical to consider the client's individual context, including their age, background, and ethnicity. Cultural sensitivity is vital as perspectives of mental health can differ significantly across cultures. For example, a younger client might benefit from straightforward explanations and a supportive tone, while older clients may appreciate a more detailed discussion about their results and implications. Additionally, understanding the educational background of the client can aid in tailoring the explanation of the results. Review of results. When preparing to present the results of these assessments to a client, it is important to first understand each tool thoroughly. The BDI comprises 21 items that evaluate symptoms of depression ranging from sadness to loss of interest. The BHS, on the other hand, consists of 20 statements that assess feelings of hopelessness, which can be potential indicators of suicide risk. The BSSI provides insight into suicidal thoughts and plans, while the BAI assesses anxiety symptoms. It is important for a counselor to be well versed in all of these assessments and understand how the tools work and what these tools are comprised of. That way, they are able to effectively communicate the results to their client and their colleagues. Informing the client and why. When discussing the results with the client, the clinician should aim to create a safe and open environment for discussion. For instance, if the BDI results indicate moderate depression, the clinician might say the results suggest you have been experiencing some symptoms of depression. This is not usual, and it is important to talk through what you are feeling. This approach normalizes the experience and encourages the client to engage in the conversation constructively. I will also note that it is important to inform clients of the results because of informed consent. Clients should be aware of the results so that they can make informed decisions for their mental health. Sample client information. The client in this sample did not really have that much details about them. From what I did gather, it was a male in their 30s. They're married, and they also have a high school diploma, and they are currently employed as a manager. Other information such as race and ethnicity cannot be gathered at this time, but it is important that if you do have a client that comes from a different ethnic background, to consider the implications of their results. When looking at this client's results, it is imminent that they have moderate to severe depressive and suicidal ideation, and it is important as a counselor to bring these results to the immediate attention of the client. It is also important to distinguish whether or not this client has an immediate need for psychological assessment due to the nature of their suicide ideation results. For example, if they are currently experiencing suicidal ideation and they have a plan to act out those feelings, it is important to let them know that due to the nature of your job and the information provided, that they will need to be psychiatrically evaluated or possibly do a safety plan to assess that they will be safe if they leave your office. Due to this client's age, it is also important to be straightforward with them about the results but also not using any technical languages that they will not be able to understand. The counselor should provide psychoeducation in a manner that the client is able to understand and in a language that they can understand. While doing this, it's also important to create an empathetic and welcoming environment to allow the client to be open and honest about their feelings, and also not making the client feel like they should be shamed for how they are feeling. It is important to be respectful of the time that the client is taking in disclosing this information to the counselor. If I were the counselor that provided this assessment to this client, I would also want to know other background information, such as how things have been going at work, how are things in their married life, if they have any kids, and if that might be the reason why they are feeling the way that they are feeling, or if they have any history of depression or suicide ideation, or if there's any family history of those things. This information gives me an insight into what may be causing these symptoms and why. It is also important to be able to pinpoint these reasons so that you can offer suggestions for treatment. Altogether, after doing this assignment, I now know about the Beck assessments, how to read them, as well as how to engage a client when assessing the results with the client. It is also important to consider when reading these results, if you do have a client that comes in that is showing signs of suicide ideation, to take the necessary steps in getting them help.